Hi guys, this is Dylan Richards here for Decker School of Nursing in Professional Issues and Nursing Leadership class. So my discussion and my research was on burnout. So what is burnout? Burnout's defined as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed yet. Um, It can cause feelings of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or related to one's job, and can reduce professional efficacy. As all of us are nurses, I don't think that I really have to dive deep into what actually burnout is because I think we all have our own definition of what burnout is. But I think our goal should be how do we control the feeling and limit it at times. So a good statistic that I put up here is 1 in 3 nurses have symptoms of high burnout, and 98% of nurses in hospitals find their work to be mentally and physically demanding, which I think almost 100% of us could all think. And 1 in 5 plus nurses work in hospitals report their intention to leave the job within 1 year. Burnout's always been relevant in nursing, but I think the COVID-19 pandemic really put a spotlight on it. Um, During the pandemic, as we know because we were in it, we were overworked and mentally and physically, having to pick up extra shifts, working overtime past our scheduled shifts, and on top of that, the acuity was higher than it had ever been, and we were frustrated and saw no light uh, at the end of the tunnel. Um, I think we're still in this staffing issue right now, just kind of following up with the pandemic, because there's so many nurses that have left our field, maybe on to travel, but just simply just have left the career, whether retiring early or choosing to go the administrative route or just choosing to not even deal with healthcare anymore because they're so burnt out. So the pandemic versus burnout. A study from CIDRAP and the University of Minnesota said before the pandemic, on average, 3.2% of healthcare workers reported turnover, compared during the pandemic, 5.6% in the beginning of the pandemic, and now 3.7% in the following 8 months. So following the pandemic, there's a half a percentage increase um, in burnout, and this is in direct correlation to the pandemic. So I just think this is all relating to being overworked, underpaid, understaffed, and overall burnt out. Um, Burnout is a costly issue for the healthcare industry, and it does impact it not just as us as an individual, but as a local and global system. It causes shortages in our hospital system, which leads to having to hire contractors such as Traveler to fill these voids. Um, this can cause companies not to be able to grow financially and expand growth in their business. And nurses are being overworked, and the last thing they would want to do is pick up an extra shift, knowing that it's going to burn them out more. So these holes that are being filled by travelers um, are just increasing and increasing and increasing, and there's really no end to it. And there really isn't much past the simplicity of the situation that nurses are getting burnt out. They don't want to work anymore. And when they don't want to work anymore, there's more holes to fill. When there's more holes to fill, it's going to make more short staffing, and it's just a repetitive cycle that seems like it's never going to end. So here's a great example of what the pandemic did to the nursing profession, which is that the vacancy rates doubled. So the burnout's real, and it's simple to say that the less nurses there are going to be the same number of patients that need to be taken care of. But this shortage of nurses is going to cause more and more nurses to get burned out. So just like I spoke in the last slide about how this repetitive cycle. I mean, if we look at this diagram in 2020, it was a little bit under 4% or under 5% of the vacant positions in 2020. And when we go to 2021, it's above, almost touching 11%. And this is just in Wisconsin. Now that's double, almost 2.5 times the amount percentage from 2020. So legal and ethical issues, it's difficult to relate burnout and ethical issues, but the National Library of Medicine correlated a really well put together case study on burnout as an ethical issue in psychotherapy. They said in one part that I liked is burnout costs employers and taxpayers billions of dollars annually in heightened presenteeism and absenteeism. At a personal level, burnout has been linked to poor physical and mental health outcomes for psychotherapists. Burnout has also been shown to interfere with clinical effectiveness and even contribute to misconduct. Hence, the ethical impact of burnout extends to our duty of care to clients and responsibilities to employers. Although this relates to psychotherapy, I think we can all agree that this 100% relates to the nursing profession. So, some more legal and ethical issues. Although we all know that the picture above portrays our realistic nurse-to-patient ratio, such as trauma emergency 1-to-1, our ICU 1-to-2, L&D 1-to-2, and any type of non-critical 1-to-4 in antepartum, and so on, to med-surg 1-to-4, and past that. But as all of us know, these ratios simply just doesn't happen most of the time. It's becoming a very controversial and ethical issue because these patients, they do need to be taken care of, but it's putting a burden of stress on the nurse. And at times patients, they're not getting the true care that they need because of the staffing issue that is related to burnout. I thought this meme was a good meme to kind of release the tension on everyone getting so heated about burnout, because I think all of us can feel and know what it really is like to be burnt out. And we all know what it is like to not eat during a whole entire shift. So the effect on the nurse or individual related to burnout. So an article that I liked is it was an article that related directly to burnout, and it brought up 3 key aspects to it. One's emotional exhaustion, and by that's the state of being physically and emotionally exhausted by work stress, which is characterized by low energy, fatigue, depression, hopelessness, and helplessness. Another is depersonalization, and that's the interpersonal aspect of burnout that manifests in unfeeling negative behaviors toward others and detachment from caring and instructions. And then finally, low personal accomplishment, and that's the state of negatively evaluating oneself as being incompetent, unsuccessful, and inadequate. Consequently, employees exhibit low levels of contribution to their work. So all of these are kind of the hints at when an individual is burnt out, and this can not only can carry in at the workplace, but eventually if it takes over you, it can transition into your actual social life. So the effect on hospital systems. Burnout is causing nurses to leave their jobs, causing more shortages, causing the hospital to struggle. And like I said in a couple slides before, they're struggling to fill in these voids, making them have to hire more travelers, which costs more than a staff nurse, becomes way more expensive. Overall, it is burning the whole hospital system. All staff are burned out due to the level of acuity and the hospital staff being given unrealistic workloads. Everyone is just a ticking time bomb, and at some point, everyone will get burned out due to this causing the hospital to be doing even worse. So I think one thing that we have to know is, like I said, the ticking time bomb. Eventually, everyone's going to get burned out, and eventually, we're going to get to a breaking point where there is no turning back, and we don't want to get to that. So how do we control burnout as a unit? So I work in the CVICU. So how does my CVICU, how does my manager, how does our hospital team on that floor try to control burnout as best as possible? A study from PubMed Central, they focused on interventions reducing burnout in physicians and nurses, which suggested that training and improving communication skills, yoga and spiritual programs such as meditation, teamwork, and other programs reduced burnout among physicians and nurses. But as reading the study more, it really showed that training and improving communication skills were found to be the most effective interventions. So another article that I found that relates directly to training and improving communication skills is this article from Tislam in 2022, recognizing training leaders need to recognize and address burnout. So that relates directly to the training and the communication, and then involving nurses in unit decisions, and that's directly to having communication skills. So our managers need to know what to identify, and our nurses need to know when to speak up and need to tell managers in superior positions what they want. And I think some of these ways are perfect ways about how to really deal with burnout and when it is coming. Some characteristics that some managers can look out for when trying to recognize burnout are increased number of call-outs, withdrawing relationships from their coworkers, and just becoming frustrated with those really small inconveniences. Controlling burnout at a system level. So at a system level, at a hospital system, we need to, overall, the solution is to protect our nurses. Now, this plays a lot of factors and a lot of things, but here's kind of an umbrella of things that need to be done to protect our nurses. It can't just be one thing. This is a tough topic to talk about because burnout has one nurse could get burned out related to something, and I could get burned out related to something else. Everyone gets burned out in all different ways. And as a hospital system level, they need to kind of umbrella everything that could cause a nurse to get burned out. So overall, they just need to protect us nurses. So this is by, first off, improving nurse to patient ratios. I think the first thing is, if we improve nurse to patient ratios, I think if we have an appropriate assignment, not even if anything goes wrong, but if we just have an appropriate assignment with appropriate staff, the right amount of aides, the right amount of nurses, free charge, all that, we always have a great day. It doesn't matter. So first thing that needs to be done is improve ratios. Second thing is have support programs. And like I said, in the unit level, include nurses in policy discussions. And not just include nurses in policy discussions and have support programs. Make sure that these nurses are getting there. Your focus needs to be on protecting these nurses mentally and physically for their overall well-being. We don't want them to maybe have an unhealthy work life to end up taking it home and have an unhealthy social life. So another article from Sachdiva, according to workforce, counseling, workout classes, anything to decrease stress, and want to create the work environment a place that people want to go to. We really want to create a great place that I'm looking forward to go to work every night or every day. And by doing this, we just really need to have our management really needs to have the nurses' backs. So some leadership styles. I chose a very unique one. As I was reading through all the leadership styles through our Huber textbook, I thought the laissez-faire was so unique, and it's something that really should be used more. And the laissez-faire leaders, they have a handoff approach and let their employees assume responsibility in the decision-making process. Although they must still set expectations and monitor performance, the style promotes complete freedom for group or individual decisions, and there's a minimum of leader participation. When dealing with the discussion of burnout, I really think that the only style should be the laissez-faire, since us nurses are the ones actually going through it. Now, I get management staff, I get that upper level staff is also going through burnout, but that's a different type of burnout. At the end of the day, we're directly dealing with our patients, and being burnt out when we're directly dealing with our patients can sometimes, if we're not paying attention, cause any type of medication error, any just type of medical error, whether it's not assessing our patient as well, it's missing something that should have been taken care of if we're not burnt out. So here's some, I thought providing challenges so everyone would be aware and educated on that. I know why the laissez-faire can be a downfall, but I want to explain to you why I really think that it would really succeed. So there's many challenges to the laissez-faire leadership system, and I got this article from St. Catherine's Nursing, and it is one of the least popular leadership styles in nursing because of the position's need for rapid decisions. While it does work for well-experienced teams, laissez-faire leaders are not effective when managing new nurses. I do agree with these challenges, but I also think that our hospitals need to try a new leadership system. This isn't very popular, and I think it needs to be used more. Now, a lot of you could be saying that the way to control burnout, the way to fix burnout and improve it is we want a democratic leadership. But that hasn't worked. I mean, we haven't gone through a pandemic in our generation, but it hasn't been working. I don't really see any light at the end of the tunnel. So I think a laissez-faire system would benefit, because if I were manager, I would say, listen, guys, if you want a solution, I'm here for you. But I think that this is a task that you guys as a nursing staff need to figure out. And overall, I feel as if involving nursing staff to make their own decisions with this really unique style of leadership, it could help the hospital the most, because if they were to complain, then it would truly be their fault for the solutions instead of blaming the hospital that, well, this didn't work. So I think if everyone was really into it, they could all work together and really put their minds and try to figure out how can we get rid of this burnout. But obviously it has to be very realistic goals, it has to be very realistic plans that have to be made. The best The best standard for establishing and sustaining healthy work environments tactic that I thought was best for this presentation is skilled communication. Like I said, how are we going to improve burnout as a unit? That's by training and proper communicating. So I thought this was the perfect example. So nurses need to have skilled communication, as we know, to have a healthy work environment. Skilled communicators focus on finding solutions and achieving desirable outcomes, such as how do we prevent burnout? Skilled communicators seek to protect and advance collaborative relationships among colleagues. And then skilled communicators invite and hear all relevant perspectives. So burnout aligns with this because if a nurse is feeling burned out, they just need to communicate before letting it get too far. So to conclude, burnout's a widely experienced obstacle in nursing. It is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. It's not just affecting nurses as individuals, but hospitals as a whole. By controlling burnout, such as training interventions and improved communication, we can help decrease turnover for nurses in the long run, which is eventually going to help our patients and our healthcare system advance as a whole.